Hi, my name is LaDonna Wright, the relationship nurse. I wanted to come on and tell you why I started the GLP medication and when I started and what it has done for me. So I started taking the GLP medication, Zepbound, in March of 2024. And the reason why I started taking the medication is because, well, I've been obese for over 35 years, ever since I had my first child, which I had at a very young age. And ever since then, I've just been losing 50 pounds, gaining 10, 20 pounds, just going back and forth with losing the weight. So the difference is in 2024, I started having symptoms of the obesity. I started not moving as well as I used to move. My A1C was pre diabetic. And I'm a nurse, so I know all of the warning signs and I know all of the symptoms of obesity and all of the diseases that are related to obesity and chronic illness. And that's not how I wanted to age. I wanted to make sure that I, had good quality of life, good longevity, and I was able to be functional. So my background in nursing is in ICU nursing and hospice and palliative care. Well, in hospice and palliative care, we were really big on symptom management and quality of life. But it was after they've already had a terminal illness. So I wanted to implement those philosophies in my life, symptom management, managing all of the health issues proactively. Okay. And I also wanted to have good quality of life while I felt good. Why I did not have chronic illness or a terminal illness for that matter. So I knew that this was an urgent thing. So I had did the research on all of the GLP medications. And from what I could tell, that this was something different, that this was a game changer on the market. And I thought, what did I have to lose? Let's try it. So I tried it. I didn't have any hesitation once I did the research when it first came out and it was Ozempic and all of the media wasn't positive towards it. So at that time I said, I didn't even pay that much attention to it. But as I declined in some of my functionality with like inflammation, I was the same size, doing the same workouts, but I just wasn't performing well and I wasn't feeling well after the workouts. So I knew that some changes were starting to happen. So I decided to try the Zepbound. And when I tell you that about 48 hours after I started the medication, it was totally a different experience for me. Like far as my mind, I had like appetite suppressant, what they call it is food noise. So the food noise was eliminated. And I could tell like 48 hours, I wasn't thinking about food. And that was a big deal because the biggest thing that I used to struggle with was willpower. I would be, and you know what, I had strong willpower. So I would do well for months. And then all of a sudden, any little thing, and I'm back eating the wrong things. And I didn't just simply eat the wrong things for one day. I would continue back to those bad habits, regardless of what the outcome was going to be. So being able to get rid of that food noise was huge for me because I knew all the things that I needed to do to lose weight. Like I knew how to eat right. I knew how to exercise and move my body and the importance of it all. And once I did some more research about, how you needed to eat more protein, all of those things made sense. Because when people, one of the terminal diagnoses for hospice was protein calorie malnutrition. And those were patients that were insufficient in their protein, in their albumin levels. So I knew that there was a direct correlation between quality of life and symptom management and just how your whole metabolism worked and the longevity aspect of having protein. So you didn't have to sell me on protein. I got it right away. And then with lifting weights, I knew that that's something I've always been interested in, actually. Back in the day, I used to look at muscle magazines and bodybuilder magazines, and I always thought that that was very interesting. And in college, I took weightlifting classes, so I was able to take all of the things that I've learned from my past and wellness and healthcare and my nursing background and really implement a program that was going to work for me. And I did. I've lost over 100 pounds. And more importantly, I've recomped my body. So I've gained muscle, lost fat, and I've become the most healthiest version of myself. And that's priceless. And it feels so good. So that's my initial journey on starting Zepbound medication and the GLP medication. For me, it was life-changing. It was a game changer. I think it really reversed the path that I was going on for our health and wellness. It really reversed all the things. And I feel so good. And I'm able to move the way that I want to move. And I'm 56 years old. So all of that happened just in the last 2 years. So I'm just, taking it all in, doing all the things. But so now I help individuals do exactly what I did. So I already had a business I'm a registered nurse and relationship expert. So I already had a business where I would do consulting on relationship things. But what I really found out is that all of these things kind of is full circle. Like the relationship that I always preach to others is the relationships that starts with yourself. So being in health and wellness is the same type of mindset, increasing the relationship that you have with yourself, becoming comfortable with yourself and knowing your body and loving your body and doing all the things that bring quality of life to your body and just being able to, dream of being healthy for the rest of your life, not accepting the condition of an unhealthy body or an unhealthy mindset, or just thinking that you don't have to, age. You don't have to age and fear chronic illness. And even if you do get some type of illness, like we never know what we can get, but if you do the right things and it's proactive and use the GLP medication as a tool, if you need it. Now, everyone doesn't need it. But if you are someone like me who's been obese all of your life and you've done all the things, you've lost weight, gained weight, and you actually kind of know how to lose weight, but you need a tool that helps you, this may be it. And I'll tell you what, it's worth trying. Yeah, if you've never tried it, you should consult your physician and try it. It may be that thing that can help. So I just wanted to share my journey about, being a, hospice and palliative nurse, working in acute care, someone who knows all about quality of life, someone who has lost 100 pounds using the GLP medication. I just wanted to share my experience and let me know, your experiences if you're thinking about trying a GLP. And most importantly, I am here to help. Like, that's my business now. So if you would like to work with me or have any questions for me, please let me know. All right, till next time, take care.